Akintama, 1.4 million, you paid clinics for patient referrals and for care that was never given.
I ran a legitimate home health company, and every week...
The man you're looking at is Akintunde Oyewale, owner of a home health company in Richmond, Texas. What happens next exposes him as the architect of a $4 million scheme built on purchased paperwork and patients who never received a single hour of care.
You bought those certifications, the clinic signed off on patients who never needed the care and never got it.
I am not going to discuss our billing or our referral process without my attorney right here.
He would not get the chance to explain. Within 72 hours, federal investigators with the Texas Medicaid Fraud Control Unit would seize the servers at Grace Healthcare Services, 2 laptops from his home office in Richmond, and a stack of signed home health certifications dated for patients who had never been seen, never been examined, and in some cases never even existed at the address on file. $1.4 million, 6 clinics, hundreds of fraudulent certifications, 57 months in federal prison, and it all rested on a single forged premise, that the patients were sick. Before we get into how this scheme actually worked, I have to ask you something. Have you ever had a family member on home health care? An elderly parent? A recovering relative? Anyone who depended on a nurse showing up at the door? Drop a comment and let me know what state you were in. And if you're not subscribed yet, now's the time. We cover Medicaid fraud cases every single week, and what you're about to see is one of the cleaner blueprints we've ever broken down. Akintunde Oyewale was born in Ibadan, Nigeria in 1976, the third of 5 children in a household where his father worked as a civil engineer for the state water board and his mother taught primary school. Education was not optional in the Oyewale home. It was the thing. Akintunde grew up reading by the light of a kerosene lamp during power cuts, finishing problem sets while his younger sisters slept in the same room. His older brother left for the United States in 1992 on a student visa, and the family scraped together what they could to send Akintunde after him in 1998. He landed in Houston with 2 suitcases, a one-way ticket, and an acceptance letter to a community college on the southwest side of the city. He took the only job he could find at first. Overnight stocker at a grocery warehouse on the Beltway, 10-hour shifts, $7.25 an hour. He slept on a mattress on his brother's floor in a 1-bedroom apartment near Bissonnet Street and spent the daytime hours at Houston Community College, working through the prerequisites for a nursing program. He was, by every account from that period, the kind of student instructors remembered. Quiet, front row. Always the first one in for clinical rotations. Always the last one to leave. A faculty evaluation from his second year described him as exceptionally reliable, with strong patient rapport and a thoughtful approach to assessment. He earned his certified nursing assistant credential in 2001, then a licensed vocational nurse certificate in 2003, then a registered nursing degree from a Texas state school in 2007. By 2009, he was working as a home health nurse for a small agency operating out of a strip mall office in Stafford, just southwest of Houston. The job is what it sounds like. You drive from house to house with a kit bag and a tablet, checking wounds, taking vitals, refilling medication boxes, talking to families. He drove a used Honda Civic with 200,000 miles on it. He kept a cooler of bottled water in the back seat, because in Houston in August, the dashboard will melt a candle. This is the part of the story that matters. Because Akintunde Oyewale was, before any of this, genuinely good at the work. His patients liked him. Their families liked him. He learned the rhythm of home health from the inside, in someone else's living room, in someone else's kitchen, sitting beside a hospital bed that had been wheeled into a dining room, because a stroke patient could not climb the stairs anymore. He married a Nigerian woman named Folake in 2010, a pharmacy technician he met at a Houston area Nigerian Christian fellowship. They had their first son in 2011 and their second in 2014. By the time the second one was born, they had moved out of the apartment near Bissonnet and into a 4-bedroom house in a master-planned community in Richmond, Texas, about 30 miles southwest of downtown Houston. The mortgage was tight but manageable. Folake worked 36 hours a week at a retail pharmacy. Akintunde took every home health shift his agency would give him. In 2015, he made a decision that would, in time, change everything. He filed paperwork with the Texas Secretary of State to register a limited liability company. He called it Grace Healthcare Services, LLC. He listed himself as sole owner and managing member. He rented a small two-room suite in a professional office park off the Southwest Freeway and applied for certification as a Medicaid home health provider. He was 39 years old. He had been in the United States for 17 years. He owned a business now. To understand what Akintunde Oyewale did next, you have to understand how home health billing actually works. When a patient is discharged from a hospital, or referred by a primary care clinic, or identified by a case manager as someone who cannot easily leave their home for care, the system has a tool for that. It is called home health, and in Texas, it is reimbursed through a combination of Medicare for older patients and Medicaid for low-income, disabled, and dual-eligible patients. The home health agency sends nurses, aides, and sometimes therapists to the patient's house. They check wounds. They administer medication. They monitor chronic conditions. They keep people out of nursing facilities, which the government would otherwise have to pay for at a much higher daily rate. The entire system runs on a single document. It has different names depending on the program. Under Medicare, it is called a Form 485, the Plan of Care. Under Texas Medicaid, it goes through a slightly different paperwork chain involving prior authorization and a physician certification of medical necessity. The exact form does not matter for our purposes. What matters is the principle. A licensed clinician, usually a physician, sometimes a nurse practitioner, has to sign a piece of paper that says, in effect, this patient is homebound. This patient needs skilled in-home nursing care. This patient meets the medical criteria. Without that signature, no agency in America can legally bill a single dollar for home health services. With that signature, the agency can bill for nursing visits, aid visits, supplies, and care coordination. Sometimes hundreds of dollars per visit, sometimes thousands of dollars per month per patient, depending on the level of care. That signature is the entire system. Everything else is downstream of that signature. The nursing visits, the supplies, the billing codes, the reimbursement checks. All of it depends on a clinician somewhere putting pen to paper and certifying that a patient needs the care, which means the signature is also the system's single point of failure. Because the doctor or nurse practitioner who signs the certification almost never sees the home health nurses who provide the care. They are not employed by the same agency. They are not paid by the same employer. They write the order, sometimes after a brief office visit, sometimes after a phone call from a case manager, sometimes after nothing at all, and then they move on to their next patient. The certification floats away into the billing system, and the agency takes it from there. In an honest system, the clinician examines the patient, makes a medical judgment, signs the form, and the agency bills for services that the patient actually receives. The trust between agency and clinician is the load-bearing wall of the entire arrangement. In a dishonest system, the clinician sells the signature. Greater Houston has, over the last 15 years, become one of the most surveilled home health markets in the United States, precisely because the federal government has watched the cost of home health Medicaid billing in this region balloon without a corresponding increase in genuinely homebound patients. The Office of the Inspector General has flagged Harris County and Fort Bend County repeatedly. Texas Medicaid has revoked licenses, frozen payments, and prosecuted owners. And yet the scheme persists because the math is simple. A single fraudulent certification can generate $10,000, $20,000, $50,000 in billing before anyone notices. Nobody investigated Grace Healthcare Services for the first 3 years it existed. Nobody had a reason to. The first kickback was in late 2017. It was small. Federal investigators would later reconstruct it from bank records and clinic ledgers. Akintunde Oyewale met with the owner of a primary care clinic in Southwest Houston, a Nigerian-American physician's assistant who ran a small practice serving mostly Medicaid patients. Over coffee at a strip mall restaurant on Bissonnette, the two of them came to an arrangement. The clinic owner had patients, lots of them. Some of them were elderly, some of them had diabetes, some of them had hypertension. Almost none of them met the strict federal definition of homebound. That is, someone for whom leaving home requires a considerable and taxing effort and is not undertaken except for medical care or short, infrequent absences. But the clinic owner could write down on a form that they were. He could sign a certification. He could fax it to Grace Healthcare Services, and nobody would check. The price was $300 per certification, cash at first. Later, through a layered series of payments routed through a marketing consulting LLC that the clinic owner controlled. For every certification, Grace Healthcare Services could bill Texas Medicaid for an initial assessment visit, several follow-up nursing visits, aid visits, and a 60-day plan of care. The reimbursement per patient ranged from roughly $2,000 to nearly $6,000 over a 2-month cycle, depending on the acuity and the supplies billed. The math, in other words, was outrageous. A $300 kickback unlocked anywhere from $2,000 to $6,000 in revenue. The clinic owner doubled and tripled his pocket money for the price of a signature. Oya Whale ran a billing operation off it. Both of them got rich quietly. That first clinic was the proof of concept. By the middle of 2018, Oya Whale had relationships with 3 more. By early 2019, he had 6. They were scattered across Southwest Houston, Stafford, Sugar Land, and a small storefront practice in Missouri City. Each one operated more or less the same way. Each one fed certifications into the Grace Healthcare Services billing pipeline. Each one received a regular stream of payments routed through shell consulting companies. Oya Whale also hired nurses, real nurses. Some of them did real visits. That part of the operation was important, because if Grace Healthcare Services had simply billed for ghost patients, the bookkeeping would have looked like exactly what it was. Instead, there was real activity. Real cars driving to real addresses. Real charting. Real photographs of medication boxes. It just was not always for patients who actually needed home health. And in many cases, the documented visits were significantly more frequent and more intensive than what occurred on the ground. Some patients were seen once and then billed for as if they had been seen 14 times. Some patients agreed to be on the rolls because a friend from church or a cousin from the clinic asked them to, in exchange for a small monthly thank you payment that they were told was a stipend for participating in a community wellness program. Some patients simply did not exist as home health candidates at all. They were diabetic, yes, or hypertensive, yes, but they drove themselves to the grocery store and to choir practice and to their grandchildren's birthday parties. They were not homebound. They had never been homebound. But a clinician somewhere had signed a piece of paper that said they were. The billing escalated. In 2018, Grace Healthcare Services billed Texas Medicaid approximately $320,000. In 2019, that number more than doubled. In 2020, even as the pandemic shut down much of the rest of the home health industry, Grace Healthcare's billings climbed past $600,000 for the calendar year. By 2021, Oya Whale was driving a black GMC Yukon. His wife was driving a Lexus RX. The family had refinanced into a larger house in the same Richmond development, and the boys were enrolled in a private school that charged $22,000 a year per student. And still, nobody checked. There were warning signs. There always are. A senior nursing supervisor at one of the clinics quit in early 2020 and sent an email to her own personal account documenting what she had seen, which her attorney would later produce. A former Grace Healthcare aide filed a complaint with the Texas Health and Human Services Commission in 2020 alleging fraudulent billing. The complaint was logged. The complaint sat. It is worth saying clearly, the patients in this scheme were not, for the most part, dramatic victims. Many of them never knew they were on the rolls. Many of them did receive a few real visits from real nurses. The damage was diffuse. It was not a single grandmother robbed of her savings. It was an entire public program. Texas Medicaid, the program that pays for in-home care for the poorest and most fragile patients in the state. being drained, claim by claim, certification by certification, for services that were unnecessary or never delivered. Every dollar that went to Grace Healthcare Services for a patient who did not need home health was a dollar that did not go to a patient who did. In the spring of 2021, an analyst at the Texas Attorney General's Medicaid Fraud Control Unit ran a routine billing anomaly query. The query looked for home health agencies in the Houston region whose billing per patient deviated significantly from the regional median. It looked for agencies that billed unusually high volumes of skilled nursing visits per certification cycle. It looked for agencies whose patient rosters overlapped suspiciously with a small cluster of primary care clinics. Grace Healthcare Services, LLC appeared on multiple lists. The file went to a senior investigator named Brenda Lee Castillo, a former Houston police detective who had moved over to the Medicaid Fraud Control Unit in 2018 and had spent the last 3 years building cases against exactly this kind of operation. She pulled the Grace Healthcare billing history, she pulled the company's enrollment records, she pulled the patient roster, and then she did the thing that, in a fraud case, almost always cracks it open. She started visiting patients. Castillo and her team interviewed patients on the Grace Healthcare roster across the summer of 2021. Some of them confirmed they had received occasional nursing visits. Most of them said something very different. A retired postal worker in Stafford said no nurse had ever come to her house, ever, and she had no idea why her name was attached to a home health agency. A diabetic man in Missouri City said a young woman had come to his apartment once, taken his blood pressure, asked him to sign a clipboard, and never come back. A widow in Southwest Houston, 81 years old, said she remembered a nurse coming twice, but that the paperwork showed 27 visits over the same period. Castillo cross-referenced the patient interviews against the billing records. The discrepancies were not subtle. They were enormous. Then she pulled the certifications themselves. Hundreds of them, all signed by clinicians associated with the same small cluster of primary care practices. She subpoenaed bank records for those practices and for the LLCs that owned them. She traced the payments backward. The payments came from a marketing LLC controlled by Akintunde Oyewale. We are heading into the federal investigation now. If you have been watching this far, you already understand that this case is not really about one man. It is about a system that runs on a single signature, and what happens when somebody figures out that the signature is for sale. Subscribe if you want to see how the Medicaid Fraud Control Unit actually builds these cases, because we break them down every single week. The federal investigation officially opened in late 2021 under a joint task force that included the Texas Attorney General's Medicaid Fraud Control Unit, the Department of Health and Human Services Office of the Inspector General, and the FBI's Houston Field Office. The case was assigned a multi-agency file number, a dedicated grand jury was impaneled, and the surveillance began. By the time agents executed search warrants in early 2022, they had been watching Grace Healthcare Services for nearly 9 months. They had subpoenaed bank records going back 5 years. They had pulled tax returns, mortgage applications, vehicle registrations, and tuition payment histories. They had interviewed 43 current and former patients. They had executed cooperator agreements with 2 nurses who had worked for Grace Healthcare, and 1 billing coordinator who had quit in 2020, and who had, it turned out, been keeping copies of selected billing files on a personal thumb drive the entire time she worked there. The billing coordinator was the one who handed investigators the spreadsheet. It was a single Excel file, 41 tabs. Each tab was a separate clinic relationship. Each row was a patient. Each column was a payment. The header at the top of one tab read, Referral Fees, Q3-Q4, 2019. Another tab was titled Cert Bonuses. The amounts were small enough per row to look like ordinary business expenses if you glanced at any single line. Totaled across the workbook, they added up to over $400,000 in payments to clinic owners and clinicians across a 48-month period. The payments were structured to avoid bank reporting thresholds. Wire transfers from Grace Healthcare's operating account to the marketing consulting LLCs always cleared just under the $10,000 reporting line. The LLCs then paid the clinic owners or clinicians directly. In some cases, the clinic owners then cashed the checks through small check-cashing storefronts on Bel Air Boulevard to put the money fully into untraceable currency. Text messages and emails recovered from the seized devices confirmed the arrangement in language that left almost no room for interpretation. Clinic owner A, in a text dated March 2019, "Got 14 more for you this month. We'll send certs tomorrow. Standard rate okay?" Oi whale, same date. "Yes, same as before. Send them through the new email this time." Clinic owner B, in an email dated August 2020, "Need the September payment moved up. School fees due." Oi whale, same week. "We'll send Monday. Use the new LLC. The other one is getting hits." A cooperating nurse described, in a recorded interview, the standing instruction she had received from a Grace Healthcare scheduling coordinator. The instruction was to document visits at the maximum allowable frequency under the patient's plan of care, regardless of whether those visits actually occurred. If she objected, she was told to bill what was on the schedule and leave the clinical judgment to others. She did this for 9 months before quitting. Investigators built a financial reconstruction that traced every payment, every certification, every billed visit, and every reimbursement check. The reconstruction took 8 months and ran to several thousand pages. When it was complete, the conclusion was that Grace Healthcare Services LLC had billed Texas Medicaid for approximately $1,467,719 in home health services that were either medically unnecessary, not provided as billed, or in some cases, not provided at all. The kickback payments to clinic owners and clinicians were the documented engine of the scheme. The smoking gun was not a single dramatic moment. The smoking gun was the paper itself, the certifications, hundreds of them, each one a small piece of paper that said a patient was homebound and needed care. Each one signed by a clinician who had been paid for the signature. Each one purchased wholesale, like inventory, like office supplies. The medical need had been manufactured. The billing had simply followed. In April 2022, a federal grand jury in the Southern District of Texas returned a sealed indictment charging Akintunde Oyewale with 1 count of conspiracy to commit healthcare fraud under 18 U.S.C. Paragraph 1349, along with related charges against several co-defendants from the participating clinics. The indictment was sealed pending arrest. The arrest team coordinated for an early morning operation. They picked a Tuesday. It was 6:22 in the morning when the unmarked vehicles pulled up to the 4-bedroom house in the master-planned community in Richmond. Akintunde Oyewale was in the kitchen, pouring coffee into a travel mug, dressed in dark slacks and a button-down shirt, and the same blue Grace Healthcare polo he had been wearing for years. His older son, 11, was eating cereal at the kitchen island. His younger son, 8, was upstairs. His wife Folake was on the 2nd floor getting dressed for her shift at the pharmacy. The knock at the front door was firm and even. 3 knocks. A pause. 3 more. Oyewale set down the travel mug. He walked to the front door. He looked through the small window panel beside it. He saw 4 people on his front porch, 2 of them in plain clothes, 2 of them in jackets with yellow lettering on the back. He opened the door. "Mr. Oyewale?" the lead agent asked. "Akintunde Oyewale?" "Yes," he said. "Sir, we have a federal arrest warrant for you. Please step outside slowly with your hands visible." He did. He stepped onto the porch in his socks. He looked back once, briefly, toward the kitchen where his son was still sitting at the island with a spoon halfway to his mouth. "What is this about?" he asked. His voice was even, almost professional. The voice of a man who has spent 20 years explaining clinical procedures to families in their living rooms. "Mr. Oyewale, the warrant relates to a federal indictment for healthcare fraud, conspiracy, involving Grace Healthcare Services. We also have a search warrant for the residence and for the company office in Houston. Do you understand?" "I understand the words you are saying." "Sir, is there anyone else in the home?" "My wife, My 2 boys. They are upstairs. We are going to ask them to come downstairs and step outside with you while the search is conducted. Do you have any weapons in the home? No. Is there anything you want to tell us before we begin? There was a pause. A long one. Long enough that the lead agent later wrote in her report that she thought he was about to make a statement. I would like to call my lawyer, Oyewale said. That is your right, sir. They put him in the back of an unmarked vehicle in his socks. He sat very straight. He did not cry. He did not protest. He stared through the window at the brick facade of his own house, while agents in vests carried boxes of records out the front door. Folak stood on the lawn in a pharmacy uniform holding the younger boy by the hand. The older boy was inside, still at the kitchen island, still holding the cereal spoon, and that detail, the spoon, would appear in the lead agent's report in a single short sentence that read more like a documentary still than a law enforcement narrative. Akintunde Oyewale was indicted, arraigned, and released on a $100,000 unsecured bond with conditions including surrender of his passport, electronic monitoring, and a prohibition on any involvement in Medicare or Medicaid billing. The charges were detailed across a 31-page superseding indictment that named him and 5 co-defendants from the participating clinics. His defense attorney was a Houston-based federal defense lawyer named Mariela Ostrowski-Jensen, a former assistant United States attorney who had spent the last decade defending exactly these cases. She did not try to fight the underlying conduct. The paper trail was too clean. The cooperator testimony was too consistent. The financial reconstruction was too thorough. Instead, she negotiated. In January 2023, Oyewale entered a plea of guilty to 1 count of conspiracy to commit healthcare fraud under 18 U.S.C. Paragraph 1349. The plea agreement included a full factual basis, admitting that he had paid kickbacks to clinic owners and clinicians in exchange for home health certifications and patient referrals, that he had billed Texas Medicaid for services that were medically unnecessary or not provided as billed, and that the total fraudulent billing exceeded $1.4 million. Sentencing was scheduled for June 2023 before a United States District Judge in the Southern District of Texas. The sentencing hearing was held on a Wednesday morning in a federal courtroom in downtown Houston. Prosecutors filed a sentencing memorandum requesting a sentence at the higher end of the guidelines range, citing the duration of the scheme, the number of participating clinics, the systematic nature of the kickback structure, and the broader harm to the Texas Medicaid program and its beneficiaries. The defense memorandum requested a downward variance, citing Oyewale's lack of prior criminal history, his cooperation with investigators, the impact on his family, and the genuine clinical work he had performed earlier in his career. A representative from the Texas Attorney General's Medicaid Fraud Control Unit read a statement on behalf of the agency. The statement described, in measured language, what cases like this actually cost. The dollar figure was the easy part. The harder part was the patients who could not get authorization for legitimate home health because budgets were strained. The harder part was the trust that had to be rebuilt every time a case like this hit the public docket. The harder part was the clinicians who did the work honestly and watched the public's faith in the system erode every time a name like Grace Healthcare Services appeared in a federal indictment. Oyewale was given the opportunity to address the court. He stood at the lectern in a navy suit and a white shirt with no tie. He read from a single sheet of paper. He apologized to the Texas Medicaid program, to the patients on his roster, to the honest home health providers in the Houston region, to his employees, to his wife, and to his sons. He said that he had begun his career as a nurse who genuinely wanted to help people, and that he could not fully explain, even to himself, how he had drifted from that man into the man standing at the lectern that morning. The judge listened. The judge made notes. When he spoke at length. The judge began by acknowledging Oyewale's immigrant story and his early career in nursing, and the genuine clinical work he had performed in his 20s and early 30s. He said that nothing in the sentencing he was about to impose was meant to erase any of that. He then turned to the conduct that had brought Oyewale into his courtroom. He said that healthcare fraud was not a victimless offense. He said that every dollar fraudulently billed to Medicaid was a dollar taken from a program designed for the most vulnerable patients in Texas. He said that the kickback structure at the heart of the Grace Healthcare Services scheme was particularly corrosive because it did not simply steal money. It corrupted the clinicians who signed the certifications. It corrupted the trust that the entire home health system depended on. It made every legitimate certification in every honest clinic a little harder for a Medicaid administrator to believe. The judge said that he was imposing the sentence in part to communicate to anyone running a similar operation in the Houston region that the federal courts and the Texas Attorney General's office were paying attention and would continue to pay attention. The sentence was 57 months in federal prison, followed by 3 years of supervised release. Restitution was set at $1,467,719, jointly and severally with the convicted co-defendants. Oyewale was permanently barred from any future participation in federal or state healthcare programs, an administrative consequence that closed the entire industry to him for the rest of his working life. He was assigned to a low-security federal correctional institution in Central Texas, a facility a few hours' drive from his family in Richmond. He surrendered in late summer 2023. Folak kept her pharmacy job. The boys stayed in the same school for 1 more year before transferring to a less expensive private academy, and then, the following year, to the local public school. The Richmond house was eventually sold. Folak and the boys moved into a smaller home closer to her parents. Grace Healthcare Services LLC was dissolved. The Texas Health and Human Services Commission revoked the company's Medicaid provider license and added Oyewale's name to the federal list of excluded individuals and entities. The participating clinic owners were prosecuted separately. Several of them pleaded guilty. 2 of them lost their professional licenses. One of them is, as of this writing, still litigating. The certifications themselves, the hundreds of small pieces of paper that started it all, each one a forged premise that a patient was sick and homebound when the patient was neither, were entered into evidence and then archived. They sit now in a federal records facility in a banker's box with a case number written on the side in black marker. The paper was the engine. The signature was the price. Once Akintunde Oyewale figured out that the premise of the entire home health system could be bought, the billing did the rest. That case was disturbing in how clean it was. But the case on the right-hand side is on a level you have to see to believe. Click it now.